Hello, good evening, everyone. Good evening, good morning, good afternoon. We are here for the day two of this epoch making training. Okay, so I promised the other time that I was going to show my face, and I think I'll be doing that just now. So I want us to do something quickly, and Bolanda is also here, the hosts from the Kaduna State's Physiotherapy Day of Service program. So I want us to quickly awaken others in the group. Some people are still asleep. Some people are still sleeping comfortably. I want us to go and let them know that we're live. We have started and then we're not waiting. We're not waiting. We're going to have fun tonight, learning, just like we did the other time. So I would want to see your comments. I am going to be checking through the comment section. Introduce yourself. Tell us where you're viewing from, what country, what states, what uh, you know, wherever, clinic, whatever you want to tell us about yourself. Feel free to do that within the next 2-3 minutes. While we wait for others to join in, we're already 25 here. I can see 25 people. You're welcome. You're welcome. Be rest assured that this is going to it's going to give you the much needed clarity when it comes to taping. And you know what? I believe this is not so difficult. Once you understand the basics, you have a very good foundation, then you won't be afraid to try out taping. So you're all welcome. I can see Chinenye Loveth, Florence Peter, Judith Chinenye. Oh, there are two people bearing the same name here. I can see Oluchukwu Mary Ann, Florence. Okay, yes, Florence. I've mentioned you already. Oluwadamilola Akinyoye. I don't know if I pronounced the second one correctly. You're welcome. Jennifer Amarachi Olufumilola Adeniran. Halima Ayokunle Ono Chinaza, Ahmad Abdulrasheed, Adedoyin Shitu, Chioma Ude, Dora Akonde, Chinwendu Ugochukwu, Temitope Olubumi, Marceline Siko, Favoline Kalu, Praise Banki. Amazing, amazing. These are the first people to join in. You are all welcome. You're all welcome. So let's have Bankole on stage to tell us. Where did I see Bankole now? Let's have Bolanle on stage to tell us about the PTDOS program and then to also give us a good introduction to what we are going to do tonight. So Bolanle, it's over to you. Okay. As you can all see, this is my face. So this me would have been brighter, but something just collapsed somewhere. Something collapsed somewhere, and because of that thing that collapsed, some things are happening. Those that understand what I'm saying, they understand. Okay, Bolale, please come to the stage. Uh,
All right, good evening, everyone.
Good
How we all
evening.
doing? All right, you're all welcome
Fantastic.
to the second part of this class. You guys requested for it, and you will have it now. Well, all thanks to Cardinal PTS, which is largely sponsored by Neuro Rehab, and also to our amazing facilitator, PT Chijoke, for putting this all together. We say a very big thank you to you all for also joining in and to make this a success because without you, we won't have this class. All right. I really want to let us know that there will be certificates for this training because I've received a lot of messages as regarding that. The instruction has been dropped on the group on how to get the certificate, but after the training again, it will be dropped on the group. But let me just make it clear. There will be a post training questionnaire. I've dropped a pre training questionnaire. There will be a post training questionnaire to evaluate the impact of the training. So do well to fill it. There's a section for your name. Please put your name the way you want it to appear on the certificate. Then following that, there will be a quiz that's just to um assess your knowledge, and the quiz is a timed quiz, so do well to answer fast before the time runs out. And there's the pass mark to get the certificate is 80%. So at least 80% to get the certificate. All right, so it's glad to see you all here and really want to learn, but I just want us to further our knowledge after this. Don't let it stop here after this class. Practice more with people, read more, attend other trainings, and all of that. And with time, we would all get perfect with this. And with that, I would like to welcome our facilitator, PT Chijoke Otipa, as it takes on the second section for this training. You're welcome, sir.
Thank you. Thank you very much. I really appreciate that warm welcome. So tonight we are going to be doing the second phase. Okay. And like I said, it's it's the more the merrier, right? The more the merrier. So invite your friends who are physios, invite those who you know should be here. Inform them on the group, ginger them up to join, ginger them up and let them know that we've started. The last session we had up to 200 people live. Of course, I know that in some countries where their national grid just fell again, some people may be having that challenge now, but we're hoping that one way or the other, people will be able to join. Okay. So I'm going to be doing a recap, a very brief recap for the sake of those who are joining this for the first time. Okay. And the whole Kinesiotaping thing. And this is why I'm doing this recap, right? I want to also help to solidify what you have learned. Okay. For those who joined the other time, solidifying or doing a little bit of a revision for you, so that when you start going through the quiz, when you start taking the quiz, right, you're going to find the questions easy to answer. Actually, the questions are easy. They're very easy and straightforward. But you need to do some thinking, some deep thinking. So what we're going to be doing is, you know, I mean, what I'm going to be doing today is basically to reintroduce the concept of kinesio. Now, if at any point my network disrupts this session, don't go anywhere. Okay. It might just pause for a while and my screen will blank out, but I'll definitely come back. Okay. I'll definitely be back here. So just hang on with me. Bolanle will, of course, entertain you while I'm out, and then when I come back, we'll resume again. So back to what I was saying the other time, what I was saying earlier. So I'm going to start by asking a question. I'm going to start by asking a question. If you want to uh, facilitate a muscle action, what direction of taping do you use? Let me see who's going to answer this. If you want to facilitate muscle action, what direction of taping should you use? Let me see. Let me be on the lookout. One plot of land for the person that is going to get it. One plot of land in Guzapi. Let's see. Origin to insertion. Kene Salomi. Oh, beautiful, beautiful. The Morgan. Interesting, interesting, interesting. Okay, okay, okay. Okay, good, good. I'm impressed. I'm impressed. See answers now. This is absolutely fantastic. I'm happy. I am very happy. I'm very impressed. Thank you very much. Thank you very much. Let me see the first person that answered that. Who was the first? Who was the first person? That's let's see. It was, yeah, it was Salome, right? Salome. Kenneth Salome. Good, good. Congrats. So that is absolutely fantastic. Absolutely fantastic. So now I'm going to ask you another question, right? And I'll start like this. I'll start this way. I want to apply this tape, this strap of tape. Okay. You can see what I'm doing. I'm just cutting, right? I'm just cutting. So I want to apply this strap of tape for, let's say my forearm. Okay. So I want you to tell me, I'm ripping this tape up, up, right? So this is what we have here. So I want you to tell me, what amount of stretch should I put on this anchor before I apply? What amount, because I want to anchor it somewhere before I start, putting my tension. What amount of stretch should I use? What amount of stretch should I use on this part that I've reserved as my anchor? Let me see who is going to make attempt. Let me see. Okay. Okay. It's anchor. It's anchor. So somebody says either. Okay, Esther was the first. Yes, I did not see Esther's response. So, I hope. Let me see. Let me see. Esther, Esther, Esther. No, I didn't see Esther. I didn't see any response from Esther earlier than this one, than Salome. Okay, so okay. So somebody already answered this one. Let me pull that up on stage. Somebody answered. Somebody answered. Where is it? Where is it? Where is it? Oh, okay. The Morgan. The Morgan. Congratulations. The Morgan. So bear in mind, when you are taping, this thing is very important, and this is what makes you different from the person who just hears about kinesiotaping, buys kinesio tape or any form of tape, and then starts strapping randomly on people's bodies. This is what makes you different. This is what actually makes you a professional. Yes, you may need some extra training, but these basic things, that's the golden difference, you know, because if you overstretch the ankle, I have tried this on myself, I have tried it on people while teaching them and all that, just to see the difference. If you overstretch this ankle, right, and apply, if you apply and you start already stretching at the ankle point, the tension around that region is going to be too much. It's going to be irritating. It's going to be very uncomfortable. Okay, so you don't want to do that. You don't want to do that. As much as possible, you want to ensure that this part of your tape is zero tension, right? So I'm using, let's say, the length of my thumb, right, as my anchor. So let's say I want to apply from here down to here, right? Or maybe from here this way. This is not a particular technique. I just want to explain something to you, okay? So let's say I want to tape from here down all the way So here. Okay, so let's say I want to tape this way and down. Okay, this actually, is a similar technique for carpal tunnel syndrome. So something like this, right? Can you see how I left the same space here, right? The same end. So this part that you are stopping, that's your end. So you don't want to add any stretch on the end, right? So you layer it down, right? And then when you are done with the application, just so that it sticks well, you rub it. You can use the backing paper. Sometimes what I do myself is to use, either I'm using the backing paper, right, to rub, or or I'll use another paper, right? Piece of paper like this, and I just rub, to activate the heat and make it stick better, right? So good, good. I'm glad that we are getting it. I'm really, really, really glad. Okay, so there should be no stretch on your ankle. Zero stretch on the ankle, zero stretch on the end, right? Zero stretch ankle, zero stretch end. Now, there are taping applications that you may have to, you know, you may have to, you may not have anchor and end. You may just have two anchors, right? Two anchors or two ends when you are doing horizontal taping techniques, right? When you are applying horizontally. So when you are applying horizontally, you want to cut the tape from the center. Okay? So let's say this is the tape, for example. If I want to rip it, I'm going to rip from the center this way. Just pull this way. You rip the tape and then you just pull. You see, it cuts. Then you can use your fingers and open this way, use this one and open this way. Can you see? Then you can apply the stretch that you're looking for, and then you layer it down. Now, if you look at the structure of this tape, right, you can see the corrugations, this line that goes like sinusoidal waves on the tape, right? And if you look very well, it's almost like you can see pores in between, you know, these lines. You can see holes, right? So the tape is breathable. It allows breeze, it allows air to pass in between the pores and all that. And then these corrugations, these lines that you're seeing like this, those are what help to bind, when it fixes on the skin, it kind of lifts the skin, right? So if I have my forearm like this, and then I do something like this, right? I do something like this. If you look, you may see the lines, it may not be so clear, but that's the kind of thing that it does, right? It lifts the skin. And when it lifts the skin, what happens? Remember, the principle of biotensegrity, right? Basically, two major things, biotensegrity and mechanotransduction. Mechanotransduction will relate more with, the effect the mechanical stimulus has on the skin, and eventually how it translates into chemical stimulus, from mechanical to what happens at the neuromuscular junction and all that, sensations get into the brain, affecting the way you perceive pain, those long, long stories, right? Now, biotensegrity is simply about relationship between the skin and the tissues beneath it. So whatever happens to the skin is already affecting the tissues underneath the skin. Are you with me? So it means that if I place this tape on the skin and it lifts the skin, that will help to decompress the subcutaneous tissues, the fascia, the lymphatic system, and the muscles and all that. So when it kind of lifts off, it's decompressing not just the nociceptors, because sometimes why the sensation of pain is heightened when there's an injury is because of inflammation. So there's swelling, and that tissue swelling is actually increasing compression of the nociceptors, the fibers that carry pain sensation. But what now happens is when you lift the tissue, you decompress those receptors, then the person feels less pain. Now, on the other side of it, when the skin is lifted from the subcutaneous tissues, the lymphatic tissues, and all that, it kind of opens up the lymphatic vessels. So there's flow, enhanced lymphatic flow. And that is why this tape can be used for different things, even for lymphatic drainage, um, lymphatic. Oh, Esther came after. So, so like I was saying, like I was saying, lymphatic drainage techniques and all that. Okay. So I'm going to be demonstrating some of those things, right? There are different ways to cut the tape. There are different ways um, to measure the tape, the kind of tension. I know you would want to know, oh, what kind of tension should I use? What degree of tension should I use for which condition, right? So now, um, and remember, like I said, I'll be going over some of the things that we have already done just to ensure that we are on track. Okay. So, and then I'll be asking questions here and there. So be ready for my questions. Okay. Be ready for my questions. Um, Now, who can tell me what therapeutic zone is? Therapeutic zone. Can anybody tell me what therapeutic zone is? Therapeutic zone. So, okay. So, oh, beautiful, beautiful, beautiful. Ah, you people have become consultants in taping. The Morgan, the area where the stretch is acting on, absolutely fantastic. I love that. Dora Akonde said the area of the tape between the ankle and the end. Beautiful, beautiful. So the treatment zone, good, 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 good. All these are correct, absolutely correct. The area between the ankle and the end, good. The area of stretch, good. The region where the stretch occurs, absolutely fantastic. I love that. I love that. Well done. You see, that's how easy it is. That's how easy it is. Once you start learning, you'll be eager to start practicing. I know a lot of you are already eager. Let me get, I can't wait to apply this and see the effect and all that. You know, um, I salute that. I commend that. This is amazing. So, the area between the anchor and the end. So if I have my anchor this way, right? If this is my anchor, if this is my anchor here, now, if this is my anchor and this is my end, right? So let's say I have something like this, okay? From this point to this point, that's the therapeutic zone. That's the region where the stretch will be applied. And that is where the target tissue that I'm looking to treat or support is will be located. So if we are seeing a patient with osteoarthritis, for example, knee OA, right? Um, you One thing that I usually do, I know I'm going to still show you this. I'm going to do practical. I would have to bring the device down to my legs, my knee. So you actually have to do a lot of palpation. So you're not just doing manual direction testing when you want to tip. You also want to know what region you need to concentrate on, right? What kind of tension are you looking at? And then what region do you need to be the target tissue so that your tape will go over that region? So let's say let's say this is the knee. Let's say this is the knee joint, right? And this is the lateral collateral ligament area, for example. And the patient is feeling pain around here. Okay, you want to ensure that your tape actually goes through and passes that point, that those points where the patient is having pain. Sometimes what I do is I can do a basic support technique for a patient's knee, for example, and I go ahead and I palpate and I find out that, okay, maybe I missed the target tissue, right? I may not have to come and start removing the tape that I'd already applied, but when I palpate and I find out, okay, what side, right? I do that before and after. So before, palpate, and then, oh, okay, this is the pain. And I use my head and I kind of look for marks on their skin that I can say, okay, this is the line, this is how it goes. Then I apply the tape, right? Some people do mark the skin, like small marks, but I don't like the thought of, having ink on a patient's skin for any reason. So, I kind of use my initiative and then know where the target tissue should be so that I'm sure I pass through that target tissue. Now, good. Okay. So there are different ways to do testing. There are different ways to do tissue manual direction testing. Okay, so it could be gliding the skin. You could, glide. You could compress or you could decompress the skin to know, what direction of taping that you want to use. Very, very important. It is your manual direction test that would actually tell you your taping direction. Okay, now, um, go over. That's why it's important to go over the first video. I explained a lot of these things in the first session. So you need to go over it if you have not done that. Okay. You need to go over it so that you get the basic theoretical knowledge of this thing. When you start the application, you will enjoy it. Okay. Now, what next? Talked about a lot here, and then the next one that we are going to do is we're going to look at the basic cuts. Basic cuts. Okay, basic cuts. So if you have your own tape with me, if you have your own tape and scissors there, you can just follow along, right? If you don't, you can always have this video. Will you have this video always? Will you? Will you? Okay. Oh, okay. I hope you will. But yeah, you have the video one way or the other. So this is a basic eye strip because I'm going to show you different chords, right? I'm going to start from the simple one and then it's going to start getting a bit deeper, right? It's going to start getting a bit, fancy. Now, this is an eye strip. So you can, when I remember when I did my internship at the National Hospital, I used to document for patients that I'm seeing and I'm taping them. I document everything, you know, down to the type, the number of strips. Okay, tape was applied using a basic knee support technique, 2 eye strips or 3 eye strips and one fan cut or one web cut or something like that, right? So that anybody who is following me can actually have an idea the kind of technique I use for the patient, right? And then I tried as much as possible to relay, to teach my colleagues whatever I was doing so that they will be able to follow up with, the patients and all that, as many as who wanted to learn. So this is a basic eye strip, okay? You can apply this directly over the target tissue, okay? Especially for more dense tissue, target tissue, right? So the amount of tension, the level of stimulus is higher with this. The level of stimulus is higher with this, okay? Now, the next one is the X cut. The X cut, let's turn this into an X cut, right? So this X cut can be used for conditions like, and remember, whenever you want to cut the tape, like this eye strip now, after cutting, you see what I did? Round the edges, round the edges. Never forget, always round the edges. Okay, round, round, round. Sometimes I just do this, fold it like this. You see, just fold it like this and this, done once and for all, right? Now, what do we do for I'm sorry, the X cut? Just fold this way, right? Fold this way. Can you see? Fold it this way and cut it from the center. Cut it from here. So we have an X cut already. Okay, so can you see this and this? I can even decide to go further. Can go further than that, right? So the kind of strip that you're using depends on the target tissue and then what you want to achieve. Okay, so you can see this. Now, if you are doing an X cut, remember to also come and trim the edges at this point. Okay, you trim each one, round each edge. There shouldn't be any sharp pointy edge, on the tape. If not, it's going to be very easy to stick, on your clothing and just roll off. Okay, so this is an X cut. This is an X cut. This can be used for what is it called? Tennis elbow, and for some other conditions, right? Especially when if there is if there's a sensitive area of tissue, right? So let's say the point here or here, the common extensor of flexor origin is is the common extensor of flexor origin is, so let's say, is irritated, right? Painful, sore. You can actually cut through the tape. Now, one thing that you should note is when you introduce a cut to this tape, it reduces the tension. Automatically, it reduces the tension. So now it means that this one now, the stimulus this would produce on the skin has reduced by the virtue of the fact that the Can you hear me? Can you hear me? Can you all hear me? Okay, so give me a second. I need to send a message to the person that called me. Uh, okay, so please give me some time. Give me some time. Give me like 1 minute. So I'll let him know that I'm live. Okay. Bolanle, please help me hold the fort till I'm back.
All right. Okay, I hope we are all enjoying this section. Can we all give a thumbs up if you've learned something so far? I hope you can all hear me. If you learned something so far, can you give it thumbs up and maybe drop what you have learned from the first section and from this also? Wait, you cannot hear me. Can you hear me now? Okay, I'm seeing your thumbs up. Keep it coming. And also, what you've learned, you can just drop a comment on what you've learned so far, either from this section or from the last section. And yes, you can't see me because my camera is off. Where I am, there's no power. So, yep. All right, I'm seeing your thumbs up. It really gladdens my heart to know that you really do enjoy this section.
Hmm? Amazing, amazing. So, like I was saying, are we back? Am I back? Can you hear me? Can you
Yes,
hear
you're
me?
back.
Good. Good. So, like I was saying, you can. Where did I even stop? I was talking about the different applications, the different cuts, right? The type of cuts that you can use. So, um, okay. So now I was giving an example, talking about this. When you introduce a cut, you have reduced the stimulus, right? If you if you want, you can actually do this. This is the one that we refer to a do not hold. A do not hold. So what I'm doing now is you can definitely learn more about this on your own when you start practicing. But what I'm doing is just to show you how easy it is, right? I've done an X cut, right? From a what is it called? An I strip. I got an X cut. From this X cut, I can bend it over this way, right? Can you see? And then cut is semicircle here. Watch what happens when I cut a semicircle like this. Watch what happens. Can you see what happens now? When I open this is what I have. Okay? This is what I have. So this is another type of cuts that you can use depending. So you may have a patient that will tell you that okay, there's a particular specific spot that is very painful, very inflamed, and if you tape over that region, it may actually irritate them more, right? So you may want to actually try. this do not hold technique, this do not hold cut. Now, I'm going to introduce you to another type, right? So there's the Y strip. So you see how we are moving from higher stimulus, we're reducing the stimulus, we have gotten to X strip to do not hold, and now we want to do something called the Y strip. Okay, so this right here, I'm going to do a Y strip here and I'll keep it so that we'll use it later for another thing. Now, this right here is a Y strip that I'm trying to make. So I'm cutting the edges, right? I'm trimming or I'm rounding the edges. Can you see? Now, we have this way. All I need to do to create a Y strip, right? A Y strip is cut from the center this way up to this. Another trick that I use is to just fold it, but not completely. So see, I'm folding it, but not completely. This can be used for people who have, very slim structure. I can use the Y strip for maybe shoulder or knee, particularly for adolescents, right? Children, and then even adults who have very, very tiny, very, very slim bodies. So look at what I've done here, and I just go ahead and I cut, right? Cut this way, cut. If you're cutting, ensure that you're using a sharp scissors. Okay, ensure that you're using a sharp scissors. They're actually scissors that are, that are specifically made to cut materials like this, right? So this is a Y strip. Can you see? It's dancing. Yeah. So this is a Y strip. Now, I'll show you how we can apply this one later. Now, for another type of, strip, this is a fan cut. I'm going to make a fan cut. If I want to make a fan cut out of this, remember, round the edges just a bit here, right? Now, what do I need to do? Fold, fold it again, and this time around, I would go this way. So you are getting it up to the end this way, right? You see, this one has come out. I'll go this one, this one, this. I'm cutting it quickly, so it may not come out so fine. Okay, I'm not looking at aesthetics now. I'm looking at time. So, you know, this. Normally, I'm meant to also come and start rounding all the edges again, right? So this is a fan strip. Can you see? Can you see it dancing? This is a fan strip. This particular strip is the one that can be used for lymphatic drainage, for facilitating lymph drainage, or actually targeting lymphatic tissue, right? The lymphatic system. So a little stretch on this, like just a little stretch on this over that swollen region, and then you can actually cross with another one, right? So um, it's a little bit complicated, but just know that, okay, you would apply this with this head going towards where you want to drain to. So let's say it's actually the leg, for example. You want to apply this with this point pointing towards the popliteal fossa, right? Let's say it's a swollen ankle. This one pointing towards the popliteal fossa. That's the back of the knee pointing upwards. And then this one goes down, and then you start applying gently, gentle, little stretch, small tension just over that swollen area. Then the other one comes from the other side and just crosses, just crisscross that region. So I'm going to show you all these things I'm talking about. It's not just talk. I'm going to show you the images. After this session, I'm going to come to the group chat and I'll show you images of the applications, right? That I have done personally. Okay, so that you see the way they came out. It can be very, very amazing to watch. Very amazing to watch while you are performing. And this is more like the fine where fine art meets physiotherapy. I've had I've had to treat doctors in the past, medical doctors, uh, matrons, people from other professions, health professions, and they just seem so intrigued with Kinesiotaping. They seem so intrigued, so interested. Like, what is this? This is so fine. Snap it, snap it, snap it. I want to see. Some patients, whenever I'm done working on their backs and I tape, they just want to. It's for them. It's like part of the therapeutic, you know, appeal that they came for to the clinic for. They want to just tape. I hope you use that fine tape. You apply. They are so happy. You see and then snap it for me. You snap, they look at it and they're like, wow, this is so beautiful, this is so nice. Some of them, when you tape, let's say I'm taping up to the next level, they want it to show. They want people to see that they are carrying those things on their body, so it can be it can look very therapeutic a lot of times. Now, the next one is a web cut, right? So this is a fan cut, particularly for fascia. Sorry, not fascia. What am I saying? For remind me. Somebody should remind me. Remind me what it is for. I said it here. The fan cut. I said what it is used for. Somebody should remind me. I've remembered it, but I don't say. I won't say. I won't say it. Let me see if somebody's gonna get it. Lymphatic drainage. Amazing. 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 Lymphatic drainage. When I too sabi book, Joe. Uh-uh. Uh-uh. You too sabi. That's impressive. There's this joy that comes with knowing that you are flowing, you know. So look at this one. This is I'll tell you something about this one, right? And I'll tell you where I have used this the most. This technique I'm about to do, this one I'm about to do. This is the web cut, right? Web cut. So it's going to be like a web, right? So I've rounded the edges. You see, I made an eye strip, simple eye strip. Now fold the eye strip, round the edges, and then cut from the center. Now watch. Unlike the fan strip, I'm not going to get to the end. So I'm still leaving a point for the anchor and the end. So you see, I'm not cutting it fully. I'm not cutting it fully. I'm going up this way, going up, but I'm stopping somewhere. Can you see that? Go up this way, up, 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 and I'm stopping somewhere. Now, the end result is this. So it looks like a basket, right? Can you see this? Looks like a basket. So this is what we have. Okay. So now, if I want to apply this, okay, I may want to start this way. Just rip off from here. Hold this point so that you can still have your anchor, and then you rip it off. Then you apply and stretch, right? So you're looking at around light stretch around, let's say, 30 to 40% of tension, right? Or stretch. And I will explain this whole thing for you, right? This whole 20 to 30, 30 to 40, 60 to 70, 80 to 90 percent of tension and all that. I will explain it for you, okay? So that it doesn't confuse you when you hear all that. Now, and one thing that you should understand is there's no rule that says you should be 100% accurate, because at the end of the day, your ability to grade tension may not be objective enough. Okay, it may differ. It is very relative. So I may pull this tape now and I say, okay, this is 20%. Somebody else comes, pulls it, maybe a younger person or a much smaller person, pulls it and says, oh, this one is 30%. But meanwhile, that's my 20. It's relative. But what I've preferred to do over time is to grade this in three categories: mild, moderate, and severe. Mild, moderate, and severe tension. Okay, so the mild one, I'll target, consider it around, uh, from 0 or from 10% to maybe 30%, moderate from 40 to 60, then severe from 70 and above, something like that, right? So it depends on the particular tissue you are trying to target. Okay, depends on the tissue that you are trying to target, and I will explain this for you. Hmm. I'll explain this for you. So let me demonstrate this stretch thing. This time around, I'm not going to be okay. Let me just quickly do that. Let me quickly cut the tape around the edges. This is it, right? This is it. And then if I want to maybe create tension on this shape, I wanted to cut from here, right? So I'll have my ankle, but let me cut it from the center. And let's just imagine that I'm taping the back, right? Or I want to do taping for SIJ. Now, let me just quickly say this, right? You see the SI joint? I used this to demonstrate. I had a one-on-one client that I was teaching kinesiotaping, and I can remember I used this to demonstrate for her, right? So this is that stretch. This, I drew this, the diagram may not be so clear again, but this is the back and this is the glutes, right? The gluteus. And then around here, this is where we have the SI joint, the sacroiliac joint. Here, here, and here, right? And this person is probably having, let's say, lumbar spondylosis alongside sacroiliac joint involvement, sacroiliac joint uh, pathology, okay, SIJ dysfunction, for example. So, or with or without SIJ dysfunction, okay, with or without. This is a general tipping for, a lot of back issues, particularly lumbar spondylosis, or other spine related conditions that are resulting to pain in the lower back. So now this application, start with this one above the glutes region, and then apply the anchor, they bend down like they want to touch their toes, right? Or hold something, hold the bed so that they don't, go too low. But the goal is, this cat and camel, when you curve the back upwards, that's the what you're trying to achieve, right? So once they do that curve, upward curve, you can now use, the paper of tension. This may be a bit more difficult to get, but then use that tension and then go while they are bending all up to ensure that your therapeutic zone passes transverses the target tissue, right? That's those paraspinal muscles, and then you get up to say a point around the scapula or something, and then they stand up and you layer down. Same thing, you do it the same thing here, right? You do that, go all the way, they stand up and you layer down. Then this one, you now cross here, right? So this is the one that you use a fuller tension. For this one that you have to go up this way, you use minimal tension, right? You are just rolling it on skin, okay? Maybe one of these days I would actually do a demonstration with a live Maybe, I don't know, but I'll see how I can do that. But that would most likely be for paid community. Um, I actually have I did a course. I did a paid course for this, but I'm not sure it's something I want to do again. I'm not sure it's something I want to do again. Um, Particularly for I've been so busy lately, so busy. So the only thing I know I may be able to make out time is to go physically to hospitals, clinics, and teach their staff. And you know, that's what I may be able to do. But maybe if the demand is there, I may consider doing an online, an online class to follow through with those who really want to learn. But that's by the way. Now, you see, this basic technique, this stretch here, right? Just this stretch. A lot of times for my patients who have sacroiliac joint involvement or sacroiliac joint pathology, um, just that one strap, just that strap, right? Just pull, stretch to like 70%, and boom. A lot of times they report significant difference just after that application. It's not complex. Just this pull and apply, right? Apply. Then if you want to reinforce it, you can use another one and just go over it. So just the way this one is, right? I can reinforce it by applying another one just here. I don't know if you can see this, right? So if I want to reinforce it, I can decide to apply another one here, just this way, right? This way. While the back is a bit stretched, I can just go like this and layer, put this down. But then I'm putting maximal or maximum stretch on the tape, but not 100, right? Not 100. You want to avoid using a full stretch, like full stretching to the point that this tape can no longer stretch anymore. You want to avoid that. So even if you want to use the whatever you want to tape for SIGA, you want to do low back taping and you're taping longitudinally, you want to reduce this just a bit, just a bit. So there will be a little bit of a slack before you actually apply. Instead of using the full stretch, you can just put a little bit. Okay. Now, now, um, we've talked about that. So let's go over to which other thing. This one, I use it for the knee usually. Now, maybe it is a no, not patellofemoral pain syndrome. Let's say osteoarthritis, right? Or anything that involves the patellar pain, the patella, right? Patella pain, or I'm trying to remember. There's this particular condition that I used. I used it for a patient. Um, I've forgotten what it is. I'm trying to remember. Uh, no, it's not chondromalacia. No, I'm trying to remember because immediately after, I think it was patellofemoral pain syndrome. Yeah, I think it was patellofemoral pain syndrome. Or immediately after the taping, right? I just did this. I just applied this, and immediately after I applied it, I couldn't even finish. That was not what I intended. That was not what I intended. I wanted to do this and still add the general support technique, right, for the knee joint. And immediately after I applied this, he got up and said he was fine. And this is like 1 year history of pain. Sometimes when I tell people about these things, it seems like it's voodoo. It seems like I'm lying, but I am the one who is doing it. I am the one who is with my patients. I'm the one who, I listen to their feedback, right? And it's not even as if I tell them that, oh, this is going to take out your pain magically. Maybe there's something inside. No. Sometimes they ask me, is there like a pain relief agent inside this? Because how does it work? Is there like something applied that it sends into my skin? And I'm like, no, there's nothing like that. I mean, there's nothing like that. This is the way it works, right? And I applied it for the guy, and then he got up and he was like, it's been 1 year. He has not been able to just get up like this without pain, or go downstairs without pain, or come upstairs without pain. That there's nothing he has not done. He has used ice to scatter his knee. He has been doing ice for over a year, hoping that this thing is going to heal. But then it wasn't getting any better. But when I applied this, I just used that technique, and he got significantly better. I myself, I was surprised. I won't lie, because there are some things that even at some point I was querying what we already know about this whole taping thing. I've seen scary results, like I've seen very strange results, right? Patient comes and complains about pain, 8 over 10 on numerical pain rating scale, and then I'm just like, okay, let me just try this. Let me just try. Let me just. Person is like, oh, I can't. I want to go. It's hurting. It's really painful, but I have somewhere to go. No, 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 no. Okay, you just do small treatment technique, small whatever, whatever, and then check the pain. The pain is still like 7 over 10, and you're like, okay. Then you remember, oh, I can try taping, and then you tape from 7, it jumps down to 3 or 2 or even 1, sometimes 0. It's scary. I mean, scary, I won't lie. But that's it. That's the good thing about this. That's the good thing about it. Sometimes you will get that. It's not all the time that you will see the drastic changes, right? It's not all the time, but a lot of the time, more usual than not, right? And that's one of the things that gives me so much joy, that I can actually, okay, just do this for the patient. Sometimes this physio thing it can be very frustrating. You're treating a patient and they keep coming back over and over and over. And you're like, this patient not getting better. And sometimes you ask them. A lot of us do not even take time to ask for feedback. Thank you very much. A lot of us do not take time to ask for feedback. So what I try to do for my patients is that I try to ask a lot of times when they come, first visit, second visit. I don't like seeing a patient more than twice, and then their condition is not significantly better. I tell my patients the goal of you coming for physio is for discharge. The goal is discharge. So if you've been coming for 3 weeks, 6 weeks, 12 weeks, 4 months, 8 months, no, something has to be wrong. It's either we have not gotten the diagnosis, or we are doing the wrong thing, we are managing wrongly. So some patients will come, and after administering this for them, and they're like, wow, okay, so for the first time, I actually feel some relief. I've been doing a lot. I've gone to different places, I've done this, pain doesn't let me sleep. But immediately you applied this for me, I could take my hand over to my other ear. I could not do this before. I knew I couldn't do it. I know I couldn't do this before. I can take this hand back like this. I can even touch the back of my head. Some people, whenever you are able to do something that takes away their pain, they start doing dangerous things. I remember seeing one woman who has had 5 years history of low back pain following a case, started during pregnancy. The doctors refused to refer her to physio, and she was just taking pain medication, pain medication. That's after she put to bed, and eventually she found me. Like, we met, and I consulted for her, and after the treatment I taped her as well. And she started doing some things that she couldn't do before. Started The speed she used to touch her toe, I was so scared. The sister was screaming, you don't know what you just did. Do this thing, she has not done it for the past 3 years. She has not been able to do this movement. She touched her toe, she stretched. I was like, madam, madam, please calm down. Don't put me in trouble. Because there's the kind of thing they go and do now. You have to go and start all over again, and it can be scary. So that aside, um, this is one thing that I know all through my practice. One modality one tool that I have used in my practice, and I can tell you for a fact that majority of the time that I applied it, I saw results. And not just did I see results, I saw results that made me happy and fulfilled, you know. So the fact that this patient can actually go for 5 days without taking their pain medication, it means a lot to me. Shady, what we are looking for is to relieve the pain. If you are going to take pain medication or NSAIDs, ibuprofen, cocodamol, whatever, before you know what's happening, the person is already having ulcer or heart issue or one thing or the other. You want to relieve the pain while the patient is now able to actually carry out their functional activities and do their exercise. That's the goal. That's the goal, to reduce inflammation and pain while healing keeps taking place, right? And also to put the body in a better environment or situation to help it heal better. Then you do your exercises. So if I am able to relieve my patient's pain with just maybe ice or TENS and then taping, and from there we are able to go to the gym, she goes on the bike, goes on the stepper, uses the quad bench, and then from there they do some walking exercises and stretching and all that. It doesn't really interfere with my own manual therapy and whatever, especially when I know how to do whatever I want to do, right? So there are some manual techniques. It's not a must that you use shea butter or neurogesic. You can actually use a massage gun, or you use your hand and just glide, right? And use other massage manual therapy techniques that doesn't involve actually using oil on the patient's skin and all that. So you can still achieve so much for your patient while using taping as an adjunct, right? As an adjunct treatment. So back to what we were saying. So I'm going to demonstrate the tension types, right? So this is a slack, right? But let me start from full stretch. I love to start from full stretch. So this is full stretch on the tape, right? So this is 100%. It can go no more. This is 100%. I can't stretch it any further, right? If I reduce this, okay, if I reduce this just a little, I can call that 90. Just a little again, I can call it 80. Just a little, I can call it 70. Just a little, I can call it 60. A little, I can call it 50. A little, I can call it 40. You see, it's already slacking. So I've gone from that 30, 20, you know, basically 20, because the tape already is pre-stretched, right? Now, like I said, full stretch, 100% stretch, tension on the tape. Release it a little bit. I can call it 90, 80, 70, 60, 50, 40, 30, 20, 10. You see, there's a slack, right? So the higher the tension, the higher the stimulus, right? The higher the tension that you are using, the higher the stimulus. And the higher the stimulus, the deeper the tissue you are targeting. Okay? The deeper the tissue you are targeting. So um that's that's basically it. And remember that there will be zero tension on your end and your ankle. Okay? So now let me look at something else. Let me look at something else that we need to know quickly. So remember to avoid using heat sources like infrared. Okay. So if a patient is already on tape, I mean, you've taped a patient, you don't have to use infrared on top of the tape. You can glue the tape to the skin and it'll be very difficult to remove, very difficult. Okay. So you may want to use other modalities. Ice is usable, right? It's usable. You can use ice on top of the tape, ice pack on top of the tape and all that, but please don't use infrared. Now, um, don't use heating modalities with caution. I would even prefer you don't use, heating modality, because the heat will definitely activate tape more. But especially dry heat. Okay, moist heat can be used with caution. So maybe hot pack and all that can be used with caution, but avoid using infrared. Um, Now, Now, there's another thing I'm going to tell us, right? Um, before you apply this tape, before while applying, avoid touching this side, this part of the tape. Avoid touching this part. If you keep touching this part, you will deactivate the glue. You will deactivate it. So when you now apply it on the patient, it won't be sticking very well. Now, another thing that you should know is if you want to apply at least 30 minutes before exercise. Let me say 15 minutes before exercise, because it's all relative, okay? But if you're not administering strenuous exercise, it's okay to apply the tape and then go straight to the gym. Or if your own physio, it's physio that will make the patient to sweat, okay? Like they are sweat, and if you don't have AC, that's also another thing. Those are the things to put into consideration. If you don't have air conditioner and patient is going to sweat, right? Apply long before they actually start doing the activity that will make them sweat. Now, um, do not tape into sensitive areas. You know the sensitive areas in your body now. This region, you see this part, uh, this front of the neck here, this front here, right? The the popliteal fossa, yeah, the popliteal fossa, the groin. These are regions that you have to be careful to avoid those areas. It can be really painful or discomforting. When you tape into those areas, it can be very, very discomforting. So now the next one is, do not use tape to pull to position. The goal of this tape is not to pull to position. And a lot of people do this, that even when they want to tape for, let's say, for facial conditions, right? When they do face taping, I had issues with some people who felt that I was doing the wrong thing. But then the principles of taping do not permit certain things, especially when you are using kinesio tape. If you are using rigid tape, you can use rigid tape to pull into position. But if you are using kinesio tape, the goal is rebound. What you have to understand is that rebound principle. Okay. So let me give you a typical example of what I mean. Not using the tape to pull into position. So I'm going to do something for the face taping. Here, my face is already sweaty. I just came back, so I didn't even have the time to go freshen up before I started live. So my face is sweaty, it may not stick. Now, this is what I'm talking about. So I'm cutting this tape for my face, right? So I want to apply, let's say, to facilitate the zygomaticus, the arch, let's say for a patient with facial palsy, facial paralysis, you want to, okay, so this may not come out so perfectly, but I just want to demonstrate something. Now, if I want to apply this, right? So I want to facilitate, maybe there's already pulling to this side, okay, to the right side, and I want to facilitate this muscle so that it will help to take it back up this way. Now, where do you think I should start my taping? Should I start here? Should I start here and here, right? To now pull to this place. Or should I start here and anchor here? So let's say, should I start towards the ear or towards the mouth? Let me hear from you. Towards the ear or towards the mouth? Where should I start? Where should be my anchor? Okay, because that's what's going to help us buttress this point. Start close to the ear. Are you sure? Are you sure? Dora, are you sure? Elia, are you sure? Are you sure? Are you sure? 100% sure? Okay, I'm seeing somebody else saying towards the mouth. Okay, towards the okay. Okay, okay. So now a lot of people, right? A lot of people actually start from the mouth. So they anchor here and then they now pull, right? And then they now pull. But that's not the goal of kinesiotaping. The idea of taping is where you start is your anchor. And then when you pull down and get to that point, right? This and this direction of recoil, I mean, the recoil action takes it back to this. So you are actually inhibiting when you do this. When you start from here and go up, you are actually inhibiting the action of the muscle that you intend to facilitate. So at the end of the day, you may end up managing the patient for too long. Okay. Remember, it is not a rigid tape. It is rigid tapes that you can use to say, oh, we don't want to drop we don't want this to keep dropping. So let's just drag it and hold it like a splint. Kinesio tapes are not splints like, okay? So you are actually going to meant to start from towards the ear, right? Around here. And then go, this is a bit too large. Usually I'll just cut it a bit so that, I'll have a strap that can actually go and end here, right? And, you know, go down this way and this one down this way. And while you are applying it, watch me. While you are applying it, you are going somewhat this way, somewhat this way. You see, there's no tension here. There's no tension, right? And before the application, you are going, you can hold the patient's mouth this way or ask them to just go like this. Okay? They can use their own finger and then right? And then you go this way, just pull. When I pull this, it comes out. It makes it easy. A lot of people struggle with trying to figure out how to actually bring out this tip. But once you hold the edge, right, and pull, you see, it comes out on its own. So I can now go, mhm, okay. You see, I can already feel this is already pulling my face to this side. I can already feel it pulling to this side, right? I may not be doing this so perfectly because I am applying it on myself. Um, okay. So look at this. Maybe by next year, if I want to teach this again, there will be there will be someone. Okay. The what I'm saying? Yes, there will be someone to use as model. Okay. So you see, it's coming out because my face is oily, right? But this thing that I just did, it's already, I can feel the pull upwards this way. I can feel it. Okay. So that's the goal of kinesiotaping. Now, same thing if I want to apply. So let's say I'm actually working on this side of the face. Now I have this strip that I can go down if I want to facilitate the frontalis muscle, right? So this one is going to go out on its own. And I have this, you start here, right? And anchor. This is my anchor, right? And then pull. Hold that anchor point. Hold it this way and pull this way. You see? But I'm not pulling it to get a full stretch, right? I am just going down, but the forehead has to be stretched. So I close the eyes, bring this down this way, and use the just a little amount of tension, very little, like 10% tension, and then I come down to this, right? And I have my end. That's all. That's all. Okay. You can also support it, you know, by doing this one again, similar kind of technique or tape beside that one. Put this one here, right? And then same thing, stretch this downwards and apply. I know I look like a masquerade right now because this is not sticking on my face. Somebody said my voice don't change. That's true. That's true. It actually influences a lot. Um, and I've been able to use this for a lot of my patients, a lot of my patients, right? So, the goal of taping is not to use it to pull. You're not using it to pull into place. You know, don't make that mistake. So now the next thing that we're going to be looking at is, okay, I've already talked about mechanotransduction, right? How the receptors receive this sensory stimulus of touch, right, or compression, or glides on the skin, right? And then they get translated, they get interpreted, and at some point, there's a release of chemicals um in the neuromuscular junction, whatever. It's a long story, but that long story is no longer my business. My goal is for my patient to get better. Okay. So, okay, like I was saying, the physical effects of kinesiotaping on the skin. It alters the shape and position of epidermal cells. This is scientific, this is research based, right? And provides continuous stimulation to sensory receptors in the skin over an extended period of time. Transmits surface stimulation to deeper tissues of fascia and muscle. So a lot of times when people ask how it works, you can explain to them, let them know that, okay, this is similar to pain gate control theory of pain. What am I saying? Pain gate control theory, you know. So it kind of gives micro massage. It's on your skin. So there's something there. There's just an awareness that there's something there constantly rubbing on that area, constantly holding. And remember how non-painful stimulus blocks painful stimulus at the lamina 2 of the spinal cord. Same story, same old story that we all know. Okay. Now, let's just go to some of the examples, quick examples. Okay, I'm going to select a few, right? I'm going to select a few. I've already demonstrated a little bit of face taping here. And yeah, I'm going to demonstrate this. Okay, so I'm going to demonstrate this one. That is, let's say, taping for the the upper extremity. Okay, so this is, okay, good. So let's say it's wrist drop that I want to tape for. That is it to say that you will always begin your taping from unaffected side? No, that's not what I said. Whew, that's not what I said. Why will you be taping your unaffected side? You don't have to tape the unaffected side. Okay, it's the affected side that you're taping. How many days should the patient carry the tape? 3 to 5 days. 3 to 5 days for more effectiveness. Okay. Um, if you are taping, if the patient is carrying it for less than 3 days, it's not a problem. Maybe it just got out before time, but it's not a problem. But it's more advisable 3 to 5 days, right? Now, for more durable qualities, I mean, for more durable tapes that have better adhesion, can actually go up to 1 week. I have some of my patients that, when I tape them, tape can be there for, what am I saying? I I have tape on my own hand that has lasted almost 7 days, right? Let me quickly show you. So I have one on my shoulder. So it depends on how far it is going to stay before before okay, before it starts getting weak. Once it starts getting too weak, you can decide to take it off. Okay. So back to what I was saying, there are different techniques for different reasons, but I'm going to demonstrate a few today. I just wanted to bring back I wanted to bring back my wrapper so that I'll be able to do the demonstration. I'll be able to show some things. Okay. So, okay. So this is my shoulder here. This is the shoulder I'm talking about. Yeah. And it's water resistant. You can bath with it. Okay. So this one, I've carried this for almost 7 days. Yeah, almost 7 days or more, right? The only thing is, if it begins to itch or get uncomfortable, you can take it off immediately. Okay. If it starts getting itchy, it's always itching and very itchy, like very uncomfortable, not something that you just itch and it will go. It's not becoming troubling. You can remove it, you can take it off. And how do you take it off? You can use baby oil, right? You can use baby oil, just apply on it, allow it to settle in for a while, and then you gently remove it. Or by the time you've worn it for a while and it's now weak, okay, it's now weak, that pulling it off will not be um too painful. You can gradually take it off, right? You can give the skin time to rest. Okay. If you want to take it off as well, you can use methylated spirits, alcohol based swab, just dab on it, and then gently remove it. If you are taking it off a patient, please do not rip. Don't rip it like Amadioha. Don't rip it like, traditional bone setters. Take absolute caution while taking it off. It can wound patients. I've seen this. Someone used it for a pediatric patient and ripped it, and the next day the mother came and was complaining. If you see the wound, if you see the injury, okay, so please handle with care. Okay, take it gently, take it easy. Rub methylated spirit, dab methylated spirit on it and remove. Use shea butter, apply on it, and then gently remove. If it's still very painful, just leave it. You shall find a way to gently, gently, gently take it off, right? um so that's it. That's it. How can you? Yeah, yeah. Can the effect of ketamine be affected by excessive subcutaneous fat? uh well, the only thing I know is there might be some attenuation, right? So like the depth of penetration of the tape, I mean the stimulus may not really get to the target tissue, right? However, from my experience, I found out that it is still, very much useful for patients who have excess subcutaneous fat. Okay. I say this, I mean, I quote this a lot, and I learned it from my brother. Half bread is better than granite. I don't know what it means, but let's just apply it here. Okay. So now this is what we have. Can it be used for Patients, shoulder subluxation in hemiplegic patients. Yes, yes, I've used it for shoulder subluxation. Oh, somebody else has asked the same question. Okay, this shoulder subluxation. Oh yeah, let's start with it. Let's start with it. So what we want to do right now is a basic shoulder support technique. Okay, basic shoulder support technique. Okay, hope people got the quote, the, the wisdom, word of wisdom that I just dropped. Eh, half bread is better than what? Yeah, half bread is better than granite. So this is the strap of clip. So sometimes if you want to apply, you can just measure out the portion that you want to treat, right? So you can measure out this way, okay? Just the amount that will be enough to go around, right? And then you cut. So I've already cut this amount, okay? Depending on the body mass of your patient, how big or how small they are. So this one, I'm cutting this. So this is what I have for subluxation, right? Um, two eye strips, two eye strips. Okay, I can add another eye strip, which is not a must, but I can add it. It may be longer than the others. So this is what I have here. Okay. So the goal again, like I said, is support. So I can start somewhere around here. Okay, somewhere around here, the top. So open this, cut, cut. You see how I ripped it apart? And I have my ankle. Now I place it on top this way. Can you see? Can you see? Here. Can you see this? Okay. Now hold that place. Hold that ankle. Right? Hold that ankle. And now you want this side, you want, because you are targeting the muscle in groups, right? So now we are looking at the first one, the one in front, the anterior deltoid, and then the anterior deltoid muscles, basically, and the anterior shoulder group. Now you want to hold here, but then you can put this arm back this way so that you can stretch out the muscle you want to apply. Is now in a stretched position, this one, right? So you hold here and pull, right? And pull. So let's say we are targeting 60, 60. You see, I'm pulling. I've pulled it and this one has come out. Do you understand? So now, let's say I'm targeting 60% tension. And remember, I said this, even if you don't know the amount of tension to use, right? You can play around 40 and 60. It's safe to play around 40 and 60, just half stretch on the tape. As long as there's a stretch on it, but it doesn't have to be so exaggerated, right? So you go this way and you see, so I've done this now, and then you can see, and then I'll bring the hand back and lay her down. Can you see this? Then the next one, same thing. This time around, take it this way. Okay, this way. this way. Put it here, such a way that there won't be what is it called? It will not be completely over this one. Okay, you catch some skin so that this will glue well. You catch some skin here, right? And then cross this arm over to the shoulder to stretch out this tissue, this muscle here. And then you go this way, stretch, right? So I'm not able to, I need to be able to hold this. Somebody would have held it for me, but you know, yeah. So stretch this one and then go this way. You see what I did? It will not, definitely not come out as I wanted it to, but I know you get the idea, the picture that I'm painting. Sorry, it's not perfect, but this is what I'm looking for. Okay, so can you see? So this one goes this way, this one comes this way, but the tissue should be in a stretched position before application. Then another thing that I can do, this one can come first, right? It can come first, can come last. But I prefer that it comes first. Okay, that this is the first application that I'm doing. Starting from here, right? Above here. And this one just apply on top like this, layer down, then hold that point, stretch out, and go down this way and down this way, right? And this is what you have. You see, I still was able to put this muscle in a stretched position, and then I layer down. I'm already feeling, I'm already feeling very much supported on this shoulder, very much supported. In fact, it feels like somebody's holding, literally holding this place like this. Okay, so that is the basic shoulder support technique that can be used for what is it called again? For shoulder subluxation, post shoulder dislocation, um, you know, shoulder pain, rotator cuff tendinitis. If it's for rotator cuff, I can decide on top of this without this one, right? I can decide to just go this way, and then do a longitudinal technique with a higher degree of tension, right? A higher degree of tension. So I'm looking at 70 to 80, right? Percent of stretch. So I've rounded the edges, and thank you very much. I'm definitely going to try this. Oh, you're welcome. You're welcome. So this is what I'm looking at, right? If it is, let's say, shoulder tendinitis, so patients had shoulder pain, you've done your cervical distraction and compression test, falling test, and all that, okay, this is not from the neck. Because this is also one thing that I noticed that we tend to underestimate, or let me say overestimate sometimes. So it's not every shoulder pain that's from the neck. It's not every shoulder pain that's radiculopathy, right? And distraction tests can actually affect the shoulder. So let me explain what I mean. When you pull a muscle, when you pull muscles that are around the neck and pull up, they can actually affect the shoulder. So it's more like your manual direction test, right? So if I pull this muscle, this my head neck upwards, it can glide this upwards, right? And actually facilitate the movement of the shoulder. So when you do distraction test and tell the patient, oh, raise your shoulder up, raise it up, and then they are now able to maybe take it higher than before, and they're like, okay, I don't feel much pain. That shouldn't be a positive sign for radiculopathy. Okay, so you should do both compression and distraction, not only distraction. Then there are some other tests. There's the um compression test and the rest of them, the Spallings test. You should be able to do other tests to determine, even neurodynamic tests, to determine whether this is actually cervical spondylosis or radiculopathy from cervical region, or it is a shoulder pathology. So you should also know your shoulder differential diagnostic test, you know, so that you are able to rule out whether it's from the shoulder or from the neck. Now, and a lot of times to see, for me personally, this is not part of what I learned about kinesiotaping, but in my own practice, I've come to realize this. If a patient comes with shoulder pain, and I'm not sure whether the pain is from the neck or the shoulder, right? If I tape the shoulder and patient reports feeling better, I know this is not from the neck, but from the shoulder. Did you get me? I know it's a musculoskeletal issue arising from a shoulder pathology, arising from the shoulder. Okay? So, because there's really no much scientific basis of how taping on the shoulder can affect radiculopathy. So it's more logical to say that when I tape here and it relieves their pain, I can say, okay, no, this is more likely a strain injury or a sprain injury, the ligament in the shoulder or the muscle or the tendon in the shoulder is inflamed, and that's why. So if it is tendinitis, I mean shoulder rotator cuff tendinitis, I can, or tendinopathy, whichever one. So, or a tear, you can go round like this. Now palpate the region that is painful. So if I palpate here, you know, this way, and it's, the pain goes into here and maybe above, I can just tape round like this. So from the center, I can rip it off from the center. You see how I'm ripping it? Just like this. It's not hard. Just as if you want to tear your exam paper. You are writing exam and it's like you don't understand what this man said here. Oh. No, don't tear exam paper. I'm just saying. So, rip it from the center. So now, see, go from here, okay, from here, you know, to here. So I can just start from here like this, layer down, and go this way. You see, past that point, go through that point that I'm having the pain, and lay down. This one too, lay down. This one goes into, you see, this one went into my chest a bit, as long as it is not uncomfortable. Yeah. So you see, my shoulder is now tapified. Are you enjoying it so far? Are you enjoying it so far? Okay. Are you having fun? I said this. I said, you know, the way I teach is you have to be having fun while learning. Because for me, learning is fun. Learning is fun, it's enjoyable. So imagine I'm teaching and I had to go and tie wrapper. I had to tie wrapper because of teaching. That's how fun it is. Okay. So um good. So the next one we're going to talk about now is is the knee joint. Okay. A lot of people have been asking me about the knee. A lot of people have been asking me about the knee. Don't worry, I'll send you some of the works that I've done. Like some of the people have taped the knee joint and all that. Very beautiful to behold. Very beautiful to behold. And um most of my patients have actually applied taping for, and it gave me joy. It gave me joy. Knee joint, knee joint, knee joint. So we're going to be, looking at the application for the knee joint. Okay. Now, let me start with this. So let's say a patient with knee osteoarthritis or patellofemoral pain syndrome or which other thing? Um, let's say any condition that affects the patella, you know. Of course, you're such a good teacher. You should have a career in lecture. Oh, thank you. Okay, interesting. My dad was telling me I should be a professor. Okay, that I should be a professor. Well, I'm already teaching. I'm already teaching. I love to teach. I love to educate. I'm a life coach, by the way. I do a lot of training, speaking. But this lecturing, I'm not that strong. I'm not that strong. Maybe in another country, sha, or hey, so like I say, let's go to the knee. So I'm going to bring this down to my knee. I'm going to bring it down to my knee joint. Let me see how well. Okay. So, okay. Good, 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 good. Hmm. Okay. Are you afraid of Nigerian? No, not even Nigerian students. No. Me, I know I can rapport with the students. It's not Nigerian. I know what I'm afraid of. Okay. So let me see if it is okay yet. Let's see. Let's see. Okay. So this is my knee. Hmm. Can you see my knee? Can you see my knee? My knee is quite hairy. Quite, quite. This part is hairy. So what I would want to do is to actually clip the hair, right, before application. But you have to ask for consent to, the country you are inside. Low back pain. How can I tape my back? I actually tape my back, but the thing is, I won't be able to do that uh, contortion today because I may not be facing. In fact, there's a lot to it. It's not easy to tape your own back. It's not easy. But if I had somebody to use to demonstrate that, it would have been easier. But unfortunately, um, I'm just here. So now I can just trim off the hair, right? Remember to explain to the patient while why you are doing that. Why are you trimming off their hair? Because sometimes you can get carried away. You want to tip and see results, and you grab scissors and start cutting their hair. This is Nigeria. Oh. Some of them will start thinking something else, like why, why, why is this young man cutting my hair with all these things that are happening? So you want to actually trim the hair carefully, explain to them that, okay, this thing I want to do, I would want to apply this tape. It can help to support the joint. Sometimes, maybe pending when they are going to get on their braces. So, some patients that you recommend brace for, and they're like, okay, I'll get it next week. I've told my son to get it or something. So, you can now tell them, okay, I'm going to apply this for you to help with the pain and provide a form of stability. It is more convenient for you. It will definitely be more convenient than using bandages, right? Bandage can be bulky and all that. So you explain to them, but then you let them know, okay, because of the hair, it may not stick well. So please, I would want to, shave clip some of the hair. So it's not a must that you barb the hair skin. You understand? It's not a must that you clean every hair. Just clip it to a point. Clip and trim, right? And then you are able to get, you know, not so hairy region. Do not shave with shaving stick, with razor. it's going to be very irritating for the patient when you put the tape on top of it. So now, when you are done with that, you wipe the skin. So ask them, okay, have you applied anything on this morning? Some people have used shea butter, they've used Nugesic, they've used all sorts of things, right? So you want to know, have you applied anything? Then if they have, you can use cotton wool and methylated spirit to do skin toileting. Wipe the area well, right, before the application. When you wipe it, you allow it to dry. Now, remember for the first one that I talked about, the what's it called, knee taping, you know, with this, right? So let's say it's osteoarthritis, and there's a lot of patella involvement. Okay. And sometimes what I do for the patient is, I don't know whether this is a differential test. I don't know what it is. I don't know what to call it, but like patellar compression. So if the patient is having knee pain, and I come and put the knee in an extended position, and I know you can't see my knee now. Put the knee in an extended position and press this way. Just press down like this. Okay. And they tell me that, oh, I feel pain with that that pressure. When you apply pressure here, it's painful. So it means that the chondral changes are actually affecting the patella, right? The degenerative changes are affecting the patella. So you actually want to decompress the patella, right? To kind of lift the patella. Now, this technique can help you achieve that. So what do you do? See, so this is what I'm, you know, ripped this part, this, and put it up here, right? Above the patellar joint. Can you see this joint? And then pull. When I pull this, bring this ones up. Can you see? Bring these ones up. Don't pull everything completely. Now, don't mind these ones. These two guys have decided to tangle themselves. Don't mind them. Instead of them to focus on life, they are busy tangling themselves. So you see, pull this one out. Can you see what I'm doing? Now I'm not using all of my finger. You can even use something to kind of to take it, pick it. You can use something like a picker or whatever to pick, right? Now follow me. You can see, I want to ensure that you can see this. So okay, so look at this now. You can take this out, you see, down like this. This one down this way. This one goes out, okay, down this way, and this one just goes this way, right? And so let's be faster. So this is what I'm looking at, right? And done. I have done this. Can you see? And then this one comes out and lay it down. Okay. So can it be applied on Erb's palsy? Yes. But if you are using tape for any child, any baby, be careful because children do not know how to give feedback. I sit on the fence when it comes to taping babies. You know, some children don't know how to give feedback, and there might be sensory changes involved, so they can actually be getting injured, and they may not be able to tell you apart from just cry, and you can't tell what's making them cry. So I'm always very careful when taping children. So, but you can. just ensure to use minimal tension. Don't use too much tension so that it doesn't um you know it doesn't place so much stress on their skin. And once you notice that there's any form of blister or it's itching the child or something, please remove. Okay, remove. Now, you see, this one already helps to decompress the patella. Can you see what happened when I straightened it? Can you see this corrugation? The way it is doing like this. Can you see? It's lifting the patella up a bit. Okay. Now, when I want to now do, if I want to do a basic knee support technique, right? I can use a Y strip, right? Or I can still use full um, eye strips. Okay, I can use full eye strips. So depending on what you want to achieve, right? Depending on what you want to achieve, you can also do your manual direction test and find out. But usually, if there is associated maybe osteoarthritis that has stayed for long, and then there's associated weakness of the what is this muscle again? The quadriceps muscle. You may want to actually start from the quadriceps to apply your tape, right? You may want to start from the quadriceps, and then I've seen people who do the knee taping from down, you know, using a Y strip and just coming down from here, starting from here to go up, right? I prefer to start from here, okay, especially if I want to also target the quadricep muscle. Now, I think when I'm done with this one, how did I cut the tape into strips? I did that. I did that in this session. It's not hard, you know. I did that. Um, I would probably just quickly do it again, but I'm sure I did. So after this one, I'm going to do now, we will do a stretch break. Okay, we'll go on a stretch break. Um, we'll go on a stretch break. So you see how this can be, and what I mean by stretch break is just for you to stretch. Okay, to stand up and stretch. Because me, I've been sitting for too long, and it's not good for me. It's not good for you. So, um, see this one now. I want to apply the basic knee support technique, and I'm starting from this direction. Okay, because I want to also um um what is it called? I want to also be able to facilitate the action of these quadriceps, right? Going this way, the insertion of the quadriceps muscles and all that thing. So good. This basic knee support technique can be used for a lot of conditions. Osteoarthritis, ACL injury, PCL injury, MCL, LCL, lateral and medial collateral ligament injury, a lot of injuries. Is the same basic knee support technique, right? So now I've gotten this one, lifting the patella, right? Remember I said when I do that compression and there's pain, that's when I can do this to help decompress the patella. Now, this one, I'm going like this, ripping this off, and then I go this way, right? See, anchor this one here. Can you see it? Can you see? So I'm anchoring this one here and bend the knee to about 90 degrees, okay? 90 or slightly above 90 or slightly below 90, whatever the case may be. But you are targeting to bend it to at least close to a 90 degrees. And this is towards the origin. And then I go down this way. Now go this way. So you see there's this, I'm stretching the tape actually. I'm actually stretching this tape. Okay. So stretch it to, this is a full stretch, right? A full stretch on the tape, and I would reduce it a bit, just a bit. I mean, this is a full stretch, reduce it a bit, and you see, and you have to be intentional about making this come out a little bit aesthetically, okay? So that the patient you are taping will not be angry. Okay, so you see what I've done, and straighten the knee, and then you have this one laid down. Now let's go again. Let's do the same thing for the other side. I'm already feeling the effect of this. So I'm going this way. Okay, can you still see? Okay, so I'm going like this way, this starting here. Remember to catch some skin. Don't go completely over this one. To be easy to stick out, to to rip out or to peel off. So you go this way. See, very easy. When I hold the edge here and pull, comes out, and then pull this, get it to this 100% tension, right? 100%, and I reduce it just a bit. You see, reduce it a bit, as if I'm removing the size of my thumb. Remove it a bit like this, and can you see what I'm doing? Remember, the knee has to be bent. The knee has to be bent, to an angle of a 90 degrees or more, or a little bit below 90. And then I have this now, and straighten the knee and lay down. Can you take a look at my knee? You will see something. See? So when I put this one straight, this is what I have. When I put this one straight, this is what I have. Can you see what I am seeing? Can you see? Let me show you well. Can you see this? Okay, I don't know if you are seeing it very well, but take a look at it. So you see how this works. Okay, it actually lifted my patella. So this is going to be doing a whole lot of decompressive work. Okay, a whole lot of decompression here. So yeah. Um. So that's it. Um. Oh wow. So somebody's asking, where can I get KT? You can check pharmacy stores in your area. Um, I do sell Kinesio tapes. But I'm only able to supply to those who are in Abuja, clinics and individuals who are in Abuja. If I find a way to way bill, I may also have, to way bill to some states, and then have maybe representatives there who can also help distribute in their states, because I realized a lot of people don't really get quality ones around. So we've done we've done a lot. So let's stretch. Let's stretch. I'm going to give us a second. What's this? I'm going to give us 1 minute. Okay. So go around, stand up where you are, and stretch. Oh, stand up and stretch, because as physios, this is part of the things that we tell people every 45 minutes, every 1 hour, every 30 minutes, every 20 minutes. And it sounds so easy, but we too, we fail woefully that part. So you can see a conference, a physiotherapy conference or a physiotherapy workshop, physiotherapy, whatever, and people are just there sitting for too long. 1 hour, people are still sitting. 2 hours, people are still sitting. I attended one. I had to go and talk to them. How about people have been sitting for too long? Is there nothing like a stretch break? Is there nothing like an activity break? Let people shake body small. Nobody even listened to me. So it's important that we do these things, okay, to keep our bodies fit. Um, First for ourselves, then for our patients and people around us. So yeah, back to what we've been doing so far. How are we? How have we been? How have we been? I hope we've been having fun so far. How has it been so far? How has it been? I want to hear from you. I want to hear from you. Oh, man. Bolanle, how are you? Bolanle, come on stage now. Come on stage and say hi to us.
Hello, everyone.
Yeah. Hello.
I hope you all enjoyed this section, or we are enjoying this section rather. I think the network has been logging me out and in and out.
Yeah, I noticed it. I noticed it. In fact, I'm even so glad that this didn't affect me because while I was at work in my workplace, um, it, all of a sudden it went out. Everything just went to zero. Network was so poor, so terrible, and my fear was like, what will I, what, what kind of explanation will I give? The other day it was light. This time network. What will I see? But fortunately, it didn't really give me issues this time around, and I've been able to just go through this session. And then, apart from the grid issue, you know, but that one we're almost done. So I'm glad.
We are many and after 1 week again, we go again.
uh, so I'm going to do the final demonstration. Okay, final demonstration. Final demonstration. And oh, that's nice. That's nice. I'm seeing comments here. Please screenshot these comments for me. I love reading them. Has been wonderful. We really appreciate shoulder session. Um, certainly. Let me see what. Certainly won't like my comeback this time. It's been interesting. Thank you. Well done. You are doing a great job. Good job. Very educative and interesting session. Well done, coach. Oh, thank you very much. Thank you all. Thank you all very much. Um, do me a favor if you're watching this, you can, just hit the like button. Okay, hit the like button on this channel. Subscribe to the channel. That's one of the ways I'll know who stopped by. Okay, that's one of the ways I'll know who appreciates the video, how valuable it is. I'll just see, okay, this number of people liked it and all that. So, um, you can do that. You can also share this session with your friends, inform them, you know, at least it's going to be open for a while. It's going to be available, publicly available for a while. I mean, for anybody who has the link to watch it, at least I'm sure of that one. Hmm. So now back to our final demonstration. I hope this one would see it clearly. Okay, so I'm going to do this for Okay, so basically, this is also another type. Okay, I didn't do this earlier, but let me just quickly do it. So if I want to also tape with a wide strip, so this is for children, I mean for younger people or for very slimmer people, right? I can start from here. For some people, they can start from down here and just go up like this. For some, you can go this way. I usually prefer this way, right? But mind you, the different positions, different directions can still give you good results. Okay. So if you try anyone and it gives you the result you are looking for, then you know, keep at it. So look at this one now. Go this way. Okay. Yeah. And then end here. This one goes like this. So you see, okay, done. C'est right? Then see how this lifts the patella. Very easy. Very, very easy. Okay. Now, let me quickly do this one for okay. Let me do this for plantar fasciitis. So there's just a lot. There are a lot of techniques. There are a lot of techniques. Um, we take you some time to practice and master. But the more you do it, the more it becomes a part of you. You know, right now, like I could literally tip somebody in my dream. I see you in my dream, and you have pain in your knee, just wrong sharp tipping. That's how confident I've become, and that is because I I showed no mercy. And one thing I would admonish you to do, I would advise you to do from here is keep doing it. Just keep doing it. When you start out doing it, you can, be doing it for free, do it for your friends, practice on yourselves, you know, and if you want to practice, you can look out for you can find cheaper alternatives that you can practice with. Then, practice with yourselves, amongst yourselves, and then before you know what's happening, you've mastered it already. Okay. So you'll become more confident as you practice. That's the same way you learn almost anything that you want to learn. Practice. Do it afraid, do it imperfect, do it over and over again. Before you know what's happening, you're good to go. Um, Speaking on stage, same thing. You have to practice. Oh, oh, nice. Thank you very much. Sir Kimpelu, thank you. Thank you very much. I appreciate these comments. I appreciate these comments. You know, hopefully we would we'll see if the board can allow us to start hosting CPD accredited training programs in future. Hopefully, I would. I know I'll be doing a lot of that if it works out. So there's just too much to share, and I also okay. I'll say that one later. I'll be doing something for all of us who are attending this training. Um, may not be related to kinesiotaping, but that's for later. If I forget, remind me. Like I said, I'll be doing something. Yeah. I won't say it yet. So now this is for okay, you can't even see my leg. This is for plantar fasciitis. Okay. So now for patients who are having plantar fascia inflammation, right? I have had it myself and I treated myself. My goodness, you don't want to experience that thing. It's like I think it's the worst pain I've ever felt in my life. I think it's the worst pain. Hi, my goodness. Apart from toothache, yes, toothache that I had, and when I removed the tooth, I have never experienced anything as painful as that plantar fasciitis. And I knew how it happened. I acquired it. I was running under the rain to escape the rain. That was how I overstressed this plantar fascia and it was the tooth. So I couldn't even walk well, but the right was terrible, right? So I didn't, when I was treating, let me tell you a little background story. When I was treating myself, I was doing all other things. I was doing ice, I was doing tents, I was doing every other thing that came to my mind. But I just didn't consider taping. The funny thing, if it were my patients that came to me, in fact, before I do two things, I'm already considering taping. But because it was me, I'd seen myself too much. I didn't consider taping. So it was the third day. Around the third day, I was in my office and I was like, should I try taping? I mean, taping could help. This is probably my plantar fascia that is inflamed. So I think I can try taping. So I left that day. I came back in pain, but I already had it in mind that immediately I come back, I'm going to tape the the foot, the feet. So when I came back, I pulled out my tapes and scissors and I strapped and taped my both feet. To my greatest surprise, I was able to walk well for the first time. For the not kidding, this thing troubled me, gave me anxiety. At the point, I just thought, is this how my feet would just go? Sometimes when your patient is having pain and they're telling you they're in pain, you underestimate their experience until you have that experience. So I asked, is this how I will continue working? What if this pain never goes? What if so many what if questions were in my head? Ah. So eventually I just tried the technique I learned how to apply, and I was able to step my feet on it. There was still pain, but the pain dropped from like 8 to 3 immediately I finished the taping. you know so I was able to now walk around. you know so when I left, I came back, I said, no, this is too good to be true. I reinforced it. I added another strap, the same technique, but I added another strap of tape, and I stepped. It dropped from like 3 to maybe between 1 and 2. The pain was still there, but I was able to do everything I wanted to do with it. And I was like, is this how is this how magical it can be? Is this how magical it can be? And I've also done this same taping for plantar fasciitis for a lot of people, like a lot of patients. I think it's only out of all the patients that I've used it for, it's only one of them that I taped and he didn't report any significant difference. So for me, I was feeling like there has to be something more to that injury. Maybe there's a fracture or maybe something. We have to send for further investigation. From my own perspective, that's the way I saw it. So let's go over to this quickly. Now, this is my foot. This is my foot. I hope you can see it. Can you? Can you see this foot? Okay. Can you see it? Let me raise it up a bit so that you see. Now, what do you do? Pull this foot up this way, okay? This way. And apply under the ball of the foot, under the ball of the big toe, right? This way, just underneath here, okay? Because this is the target tissue. This is the target tissue. Now, a lot of people with plantar fasciitis, when you begin to, sometimes you may even discover that they have pain around here. So I palpate a lot. I try to know all the regions around the foot where they have pain. So, you press here. When it happened to me, it was around here, basically around here, you know, that I was having that pain. So you can press down this way and see where the pain is, all the way, feel around the heel, press, squeeze, and find out which areas, because those are the areas that you want to make your target tissue, right? So you pull this one. Now you see this one has gone, I have taken it this way, right? And then from here, I go and pull, right? Pull and up to this point. My leg is already vibrating out of fatigue. So see, this is slack on the tape. Pull up this way. So I'm looking at the, let's say, 70% of tension, right? And then come up this way. Okay, okay, and done. Hmm. You know, if if the pain goes into the Achilles tendon, so if you palpate and discover that this pain, even up to here, because sometimes it could literally be linked and go run all through up to here, right? The insertion of the Achilles tendon. Otherwise, if it is just around here, it's okay to stop the taping here. If the pain goes up to here and the patient is not as hairy as I am, you can actually continue this taping with a longer strap of tape up to the calf muscle. You understand? If you have enough tape, or if the patient is staying for the tape, you can strap out to out to up to here, right? Up to the calf. So this is what we have, right? And after doing this one, that's not all. That is not all. You can now take another strap of tape. Let's say 2 eye strips. Even this one that I did here, you can even cut it to be like a fan strip, 1, 2, 3, or 1, 2. And just spread it depending on, maybe how thick the person's foot is, or how big or small or tiny it is. Okay. So now this one, so let's say the patient's pain is over here, right? Patient is also feeling pain around here too, right? So you want to just go over that point. Now, for this one, you'll be using further stretch. You'll be using higher percent of tension. Okay, pull this way, and just a little bit of a little release on it. Then you go all the way, all the way, all the way, and then lay it down. See, as I've laid this one down, then I have my anchor. So now there are two anchors or two ends, right? Done this one, and this one. I don't know if you're seeing it, but this one, and then that's it. Okay. So with this, you can also you can also um you can also do the what is it called, um reinforcement. Okay, you can also reinforce it by doing another strap of tape, you know, on that. So you see this one. So this is how it's going to look. Okay, this is how it looks. On my. So with this, if patient's uh, pain is now much better, Then you can continue with your progressive loading, strengthening exercises, and all that, you know. And if you need to, maybe there's also pain around here or around here, you can tape. Then, if there's need to tape around the calcaneus, the heel region. Let me not just waste another tape. Um, let me use this one. So let's imagine that I didn't cut this one. Let's imagine that I did not cut this one. Okay. So it's not even it's not giving me what I'm looking for. So this is the last one, guys, ladies and gentlemen. So this is the last strap that I'll be putting on. So that's if there's pain around the heel bone, around the calcaneus. So this good, 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 good. Can you see? Yes. So I can now go like this. I can now go this way. Can you see what I'm doing? See? And layer this one down and this one. Don't know if I got it correctly. And that's it. Okay. So this is the way it appears. And you can actually get some significant difference from this. So yes, we have come to the end of this amazing so we've come to the end of the session. We did this amazing. My 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 salute, my royal salute goes to all of you. So uh, uh I've been trying to be stoic and a little bit of Asian to not admit that my back hurts. Okay, so yeah, thank you very much. Thank you very much. Thank you very much. Oh, Nasiba. Okay, thank you. Thank you so much. I am glad. I am very glad. I am very, very glad. I'm very glad. I wish this was a physical event, you know. I wish it was a physical event and I would be able to just take pictures together, you know, all the noise, make all the noise together and all that too. It's all good. I believe one day, one of these days, would have an opportunity to do something physical. Yeah. For me, I'm always biased when it comes to physical events. I'm always like, yeah, for my people in Abuja, for my people in Abuja. But definitely one day, maybe one day, a conference or anything, I know I'll be there. And then we'll get to hang out together. Oh, see the way my house is littered with Kinesio tips. Okay. So, does anyone have questions? I think Bolanle's either her battery has gone down or something. But if anyone has questions, I would be glad to answer the question before we call it a night. Ah, I will answer the ones I can answer. I will answer the ones that I can answer. The other ones, I'll just keep them for later. Thank you, thank you, thank you. Oh, thank you, thank you, thank you. I'm screenshotting all of this. So. I'm screenshotting all of them. Thank you so much. Thank you so, so much. I'm glad. I'm glad. I see you. I see all of you from from Ubom Ime, Well Aid. I see you. Chinwendu Gochukwu. I greet you. Elsie Bob Manuel. I see you. Judith Chinenye Emmanuel Prosper Olua Damilola Akinyoye Oluchukwu Mary Ann the Morgan Ifeoma Francisca Tosin Banjo Fumi Akewi MC Toposh. Oh, MC Toposh. Marceline Siko Sunday Arogundadi. I don't know if I pronounced it correctly, but I'm loyal. I'm loyal, sir. Ezaku Israel. Thank you for joining in. Olatayo Abiodun. Oluwadamilola Akinpelu. Majida Musa. I'm grateful. Happy to have you here. Dora Akonde. Yeah, I think I've shouted out before. Olawoyi Abdul Koyom. Well done. Ayodeji. Omali Chachi. Praise Banky. Doreen Aziken. Peace. Okoye, peace. Peace Okoye. Peace Okoye was my assistant when I was in school as the class rep. It's an honor to have you here. So, Adeshewa Ann, Favorlin Kalu, who else have I not mentioned? Favor Emeka, Angie Meek, well done. Well done. I met you, that was last week, Friday. Well done. Dora Akonde, Bana, welcome. Good to have you here. Bana was my classmate in school. Good to see her here. Oladotsun, Ebube Uchendo, good to see you. Good to see you. Ogochukwu Ozioku, good to see you. It was nice having you here, honestly. Nice having you. Felicity, Felicity Designs, good to see you. Thank you for always making amazing designs. Emmanuel Prosper, Olatayo Abiodun, Umo Udon. Can KT be used in correction of bunion? The answer to that question is that bunion cannot be corrected. The only thing is it can help to prevent further deformity. Using a K-tape or a bunion, they call it bunion correctors, but it's usually very controversial. There's bunion braces, you know, but taping can help alleviate their pain. I had a patient in when I was doing my NYC camp who had bunions, right? And it was a very, very severe one, very painful ones. And it flared up while she was in camp. Um, I knew that, I mean, there's nothing I'm doing to correct the bunion per se. But then the taping helped to kind of separate the tools a bit and also support that area, right? Decompress the nociceptors, all the basic principles of how taping helps to relieve pain. So I taped her, she felt better. So when she felt better, I knew that was an indicator that she would do well with a brace, a bunion brace, right? So I had to recommend one for her, which she got. And while she was wearing the brace, I was still taping her. So when I tape, she wears the brace on top. So it helped her while it lasted. So but the only way, if is any need for correction of bunion, is to go for a surgery. It's usually minor, it's not so much of a serious surgery, but to go for a toe correction surgery, bunion correction surgery to have it corrected. Otherwise, it can't be managed conservatively. But it's not as if you are looking to, you know, um to cure the bunion with taping or something like that. It can only alleviate the pain, prevent further deformity, while the person, whoever waits for the surgeries, if there's need. Okay. Sometimes even going to the doctor or the orthopedic surgeon to say, "Oh, I have a bunion. Um, they can. I want to remove it. I want to do a surgery." They will examine you, and if they find out that there's need for surgery, fine. If they decide that, oh, no, 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 it doesn't seem that serious, just continue doing whatever, doing conservative care. You don't want to just opt into surgery like that. That's also fine. Okay. So I see you, Uchenna Oluwatosin, the Morgan, Omalichachi, Chinwendu Gochuku. Oh, okay. Um, Pelaya, Uchenna, Amara Confidence, Gaius Jacob, Jennifer Amarachi. Oh, thank you. Thank you, Jennifer. Really appreciate. Oh, thank you. Happy to read this. Happy to read this. Thank you. Really appreciate your efforts, and you already made a lot of impact in us. Thank you. Thanks a lot more, Big Chijoki, for the selfless service. It would be nice if you would have us some other times. Definitely, I would love to. I would love to just stay in touch. Stay on that group. I'll definitely come up with. We can do a lot more. We can do a lot more beyond kinesiotaping. And if it is something that you would love to experience, then I'm willing to go the extra mile, and then would talk about other things. There's a lot more. There's a lot more we can do. So we can start building up from here on. Okay. Um then then let me see. Oh, India. Wow, somebody stayed up in India by this time. I know two people are actually here from India. If there's any other person from India that I have not recognized, please just notify me. I think they deserve a special gift, because like it's a very odd time in India right now for them to be up awake to join this session. That's really commendable. Thank you for joining. Thank you for joining. Let me spotlight them. Pravana Pravanya Thaluri from India. Thank you so much. Oh, thank you. Thank you. Happy to have you here. Happy to have you here. Is there any technical measures to be taken to determine the length of the tape needed? No, no technical measures. Just measure the length of, ensure that you have enough length to go through the therapeutic zone when you stretch. Okay. Use your senses, know the amount of stretch you want to apply, then you leave room for your end and your anchor with no stretch. So you now know that, okay, if I measure the length of this muscle, right, I can reduce it a bit because I know I will still stretch. You understand? The length of the therapeutic zone, the target tissue, I'll then reduce a bit because I know I'll still stretch. So it's not hard. It's not a hard and fast rule that you must measure 4 blocks of tape or measure 3 blocks of tape or whatever. Okay, just use the target tissue for emphasis. Now, the next person, Ayodeji Ogunrinu. Is there any technical measures to be taken? Okay, yeah, I've answered the question. Physio in Yoruba language. Thank you so much. Thank you so much. Thank you very much. Physio in Yoruba language. Interesting. Maybe we'll need someone to be doing physio in Hausa and physio in Igbo for us to. That would be really nice to have a place where you can go and you understand physiotherapy in Igbo language, in Hausa language, in Ibibio, whichever language. Thank you, Emmanuel Prosper. Thank you. Abona Joy Ese Comfort Iyama. Can taping be used on spondylolisthesis? Yes, it can be used to relieve the pain and discomfort while you do your exercises and other techniques that you want to use. Okay. Um. So whether or not they are going, depending on the grade of the listhesis, right? So whether or not they are going to be on braces, you know, you can still apply the taping as long as it helps them. Okay. The next one is, can taping be used? Okay, yeah, I've answered that. Now I can go taping my patients. Tinubu should be taped. No, no problems, no problems. That one is no problem. I agree with you, sir. I agree with you. God have mercy. Thank you so much for this elaborate and impactful session. Thank you, Hawa. Thank you, Hawa. You explained and demonstrated it so well in an interesting way. God bless you, CJ. God bless you, Hawa. Hawa is a mentee of mine who I am very, 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 very pleased with. Well done. Glad that you attended this session. I'm glad. Fatima Bichi, thank you so much. It was really an educative one. Thank you so much. Thank you, Ma Adelike Oluwatosin. Thank you very much. So at this point, we'll call it a night. Remember, if you have not, if you've not subscribed, please do. Please do. There's a lot, and if you go to my channel, there's a whole lot. This Chijokotiba Growth Academy, if you look at it, you will see that it is not a physiotherapy based platform, right? I actually wanted to create another channel for physiotherapy only, but then I thought of it. I thought of the fact that as physiotherapists, our lives are not tied, our lives are not tied solely to physiotherapy. Our lives are not tied only to physiotherapy. We are still humans at the core of everything. We're still human beings and we need to grow. We need personal development. We need financial intelligence. We need to understand how to build communities, how to network with people, how to communicate our ideas, how to speak in public, how to sell our craft or sell our skills or sell our profession. We need to learn how to build a personal brand and all that. So, yeah, I thought of it and I was like, why not? Okay, so let me carry it along in this particular channel. So, it's more like a collaboration with my own brand, my own academy, Chijokotiba Growth Academy. So you are welcome. The doors are open. You know, learn as much as you can. Go through other videos that are there, other playlists. Check out all other things that you can see. And if anyone strikes you, feel free to consume. Feel free to consume. Okay. So in that our group, I'll communicate more with us. I don't want to keep us waiting for longer than you know than this. We've already stayed very long. 2 hours, 45 minutes. That's a lot. You have invested greatly in yourself beyond even the certificate or any other thing, beyond all the paparazzi. You have invested greatly in yourself, and that is worth celebrating. It's worth celebrating. And trust me, this is going to pay off. It's going to pay off. The energy you've put in, the time, the data, everything is going to pay off marvelously, wonderfully well. Thank you very much once again. So the procedure for accessing the certification and every other thing, I'll communicate through the group. Okay. So there's no way if you attended this particular class, there's no way you will not make an A in that quiz. Like you will score very, very, very high. Very, 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 very high in that quiz. Okay. And it's a timed test. is a time test. So once you click, the time starts to count, and you cannot log out to go and check answer and come back. It will detect it. Okay. So um that's it. That's it for now. That's it for now. Thank you all very much. I look forward to your feedback, your amazing feedback. You know, the group is open. Come in, share your feedback. Yes, 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 yes. Remind you of something good. I'm going to send a message, please. I'm going to send a message on WhatsApp. You know, remind me. Just keep reminding me. Keep reminding me. I'll definitely do it. I know what I have in mind. I'll do it. Okay. So just engage in the group. Engage in the group. I'm going to leave it open for a while too. If you try taping in your clinic, you can post it on the group and tell us what you're doing. I'll also be sharing some of the works I've done in the past, so that we'll be inspired to actually start this journey of taping. And if you want me to do a personal one-on-one with you to take you through head to toe taping for different conditions, neurological, musculoskeletal, sports, even women's health to an extent, if you want such one-on-one, you can reach out to me, and then we'll discuss about how to go about the terms and conditions and all. Then if you want group, if you feel like you want to organize a group training for your people, for your staff, for whether it is physical or online, physical in Abuja, except you are ready to fly me to your state and I'll come, or your country, I'll come. But physical events happening, I'll be able to do them in Abuja. So if you want us to do something like that anytime soon, then reach out to me so that we can plan for it. Okay. So thank you. Thank you very much. Lara Ekube Saiwo. Thank you, ma. Thank you, ma. Thank you very much. So I look forward to connecting with all of you. Send me a message on WhatsApp from the group. Let's connect. Okay, let's connect and keep growing together. Have an amazing night rest. Bye. Don't forget to subscribe, like I said earlier.